a grown-up man coming to the clinic and starting cry. The reason? He couldn't father a child. 1/3 of cases, it is the man who's got the problem. In 1/3 of cases, it is the woman who's got a problem. And in another third of the patients, both male and female have got a problem, or it is not known. It's quite true that over the last 50 to 75 years, the sperm count has dropped to roughly half of what it was. A few weeks ago, a couple came to my clinic, and even before they had mentioned all about the case, the man started crying. Imagine a grown-up man coming to the clinic and starting cry. The reason? He couldn't father a child. He had no sperms in his testes, and he felt that he had lost his manhood. He felt very depressed, and he felt as if he no longer was a man. Such can be the impact of male infertility. Infertility is a term which everybody understands, but now it's been replaced by subfertility, because even when there is little chance, it's quite possible to get one sperm enough to fertilize the egg. Give me a sperm and I'll produce a baby, said one of the gynecologists in one of the conferences. It's true, but that sperm has got to be healthy, it's got to move in the right direction, it's got to be of a certain caliber and movement of certain speed in order to go and fertilize the egg. And the whole game of male infertility is to get that one sperm which will be of a good strength and caliber to fertilize the egg. The global incidence of male infertility is between 13 and 18%. Male infertility is found to have a role in approximately 50% of infertile couples. In other words, in 1/3 of cases, it is the man who's got the problem. In 1/3 of cases, it is the woman who's got a problem. And in another third of the patients, both male and female have got a problem, or it is not known, which comes roughly to about 50% in problem in males. Unlike the famous mothers-in-law syndrome, where everyone blames the bahu of the family, the lady of the family, to be the cause of infertility, it is actually equal between male and female. And globally, an estimated 6% of adult population, 6% of adult population is a big number. They are thought to be infertile. It's quite true that over the last 50 to 75 years, the sperm count has dropped to roughly half of what it was. Therefore, in the 40s, if it was 116 million per ml, it is now 60 million per ml, or even less. So much so that WHO has classified that anything above 15 million per ml of sperms in the sample is normal. Why that should happen? There are many causes of this: pollution, radiation, lifestyle. All these have made these changes. This is what I was telling you about: 130 million per ml in 1940 to 66 million in 1990, and now even less. There's a 20% drop in volume and 58% decline in sperm production in the last 50 years. Now here is a slide which I used to show to my students quite regularly in the 90s, and also in the CMEs that I used to go around. See the bottom line: idiopathic. Idiopathic means where the cause is not known. That constitutes about 1/3 of all the cases of infertility. Is it really idiopathic? Now, with new insight into this segment of medical science, fertility segment, and in recent advances in the management of infertility, we know that there are certain elements which cause this problem. The other causes are obstruction, tumor, testicular tumor, antibody antigen reactions, cryptorchidisms, that is the testis inside the body and not hanging outside. Incidentally, do you know why the testis hangs outside the human body? Because the temperature there in the testis is 2 degrees less than the rest of the body. And if a person has varicocele, which means that there are a clump of veins covering the vas deferens, which is the tube which carries the sperms, then this temperature is mitigated. This temperature difference is lost, and therefore the sperms are not motile and they also die out. Infection is another very common cause of reduced sperm count and motility. But let me concentrate on idiopathic, where the cause is not known. Now, with the modern science, we know that this so-called male infertility is many cases is due to genetic causes, environmental factors, reactive oxidative species. Now, what are these reactive oxidative species? In the body, oxygen is present as elemental oxygen, and the electrons move in a circle around the atom. One of the electrons, when it's taken out of the oxygen molecule, the oxygen becomes nascent oxygen, but that electron has given energy to the cell. In the process, the oxygen becomes nascent, and that is very destructive for the cell membrane and for the cell itself. So even though the energy is given, there is a destruction due to the oxidation. Now this oxidation and control of oxidation is a very fine balance in the body. And there are reactive oxidative species which are ROS, which are present in the body, which mop up these nascent oxygen. They are preventing the cell from being damaged. So these reactive oxidative species, if they become too much in the body, then there is more destruction than assimilation. And this occurs in situations of pollution or smoking. I'll come to that in a little while. The dietary factors, the micronutrients, they are important. And so let us concentrate on the environmental causes, which are really becoming very important nowadays. Excessive heat, infection, radiation exposure, heavy metal toxicity like lead, cigarette smoking, xenoestrogen exposure, pesticides and other chemicals. All these are being used nowadays, are become very important. And that's one reason why climate change should be a major factor by nations, because these environmental causes are all ruining not just the human body, but also the progeny, the generation that's going to come. Oxidative stress comes from various factors. As I mentioned, if you look on the right side of the screen, you'll see that many factors, including infections, medicines, varicocele, smoking, cancer, and immature abnormal sperms. All of these cause cell damage, and therefore, when there is a damage to the sperm, there is infertility. So, to sum up about oxidative stress, excessive seminal ROS levels have significant toxic effects on both the sperm quality as well as function. Increased seminal ROS can lead to decreased sperm motility, and ROS causes damage to the flagella membranes through lipid peroxidation. They can cause an ATP depletion. ATP is the energy source, thus depleting the sperm of energy and required for motility. So you can imagine what destruction oxidative stress does. And what are the ways of reducing it? Here comes the role of micronutrients. Nutritional factors are L-carnitine, coenzyme Q10, zinc, arginine, and vitamin B12. These are all important for the growth of the cell, not just the sperm, but the growth of the cell in general. And they are present in lycopene, vitamin C, E, glutathione, and selenium. Lycopene is present to a very large extent in tomatoes. I recall a case where I told the couple that lycopene is present in tomatoes, so you go and have a little more tomato in your diet. 1 week later, the man came back to me, Doctor Saab, bachalo, save me. I said, what's happened? He says, breakfast, tomatoes. Lunch, tomato soup. Dinner, tomato vegetable. He says, even my skin has started smelling of tomatoes. I had to counsel the lady that you can't give so much to tomatoes.
बंद करो, हाथ जोड़ के मैं गुजारिश करता हूँ.
Same amount of lycopene is now present in tablets which are freely available in the market. Same goes for coenzyme Q10, which is also a very important factor in controlling male infertility. Now, some of the other points. Varicocele, I've talked to you about this. If you look to the right side of the slide, you'll find that there are veins which are much more in the diagram. And these cause not only symptoms of pain and discomfort, but also infertility, because they reduce the temperature or increase the temperature, thus killing the motility of the sperms. Infections of the genitourinary tract like urethritis, prostatitis, orchitis, and epididymitis, they all are harmful for the proper growth of sperms, and they have to be controlled before any fertility question is taken up. This is also a very important point in the treatment of male infertility. So the take-home message is that male infertility is a reality. Idiopathic male infertility is the most common etiological factor for male infertility. Reactive oxygen species, micronutrient deficiency, environmental factors are the most common pathological reasons for male infertility. And the net result is that a person gets a low sperm count, there's morphological damage to sperms, and there's reduced sperm motility, all of which prevents a person from having a child. So what can be done to improve the status of the sperm's low motility, count, morphology, and the functional status of the sperms? Antioxidants like lycopene and sperm energizers like CoQ10 and carnitine can be good options for treatment in idiopathic male infertility. These antioxidants and micronutrients are freely available in green leafy vegetables, in broccoli. They are also available in non-vegetarian diet, but the Indian diet is just as good. The nuts and fruits also have micronutrients in them. In cases where the infertility is secondary to a condition like varicocele or cryptorchidism, that is, the testes are in the body, and infections, the primary condition has to be managed. And then the conditions where the infertility is secondary to organic condition like varicocele, obstructive azoospermia, infections, the primary condition has to be treated, and then that will help the sperms get back to their normal mechanism of action and normal strength. Again, lifestyle modification is important. A good diet, exercises, good sleep. I'd like to refer you to one of my earlier videos on this issue. If you like my video, then click on the like icon. If you have any comments or suggestions, or indeed you want to speak on some topic, then use the comments section. And please click on the subscribe button, because that will help me bring more videos of this kind for your benefit. Till then, have a great day.